Hello everyone. Today I'm going to be talking to us about culture of health. A lot of people have asked me, what does it mean? This culture of health you talk about, what does it really mean? Now, in simple terms, culture of health or instituting a culture of health is simply the process of naturalizing the promotion of health and well-being in one's lived-in spaces. Now, our lived-in spaces can be at our workplace, it can be in schools, and when I say schools, I mean primary, secondary, tertiary schools. And then it can also be in places where you spend a lot of time, especially, for instance, if you're traveling, it can be in an airplane. So we can institute a culture of health, in air travel. We can institute a culture of health in land travel, if for people who do long distances in buses, in coaches, and all of those things. We can institute a culture of health even in our environment, in the environment where we live in, our consciousness of health and well-being, inculcating all of this into our daily lifestyle is what it means to institute, to naturalize and establish a culture of health in our workspaces. Now, what are the advantages? Why do we need to institute a culture of health in our living spaces, in our workplaces? Now, for our workplaces, it's been said that from global statistics that says that there are 160 million work-related diseases and health hazards just from the workplace. And also that 4% of annual GDP is lost to work-related injuries, and a whopping $1.25 trillion is lost to absenteeism, work-related hazards, work-related job losses, and all of that. So when we look at it economically, and even from the health standpoint, we know that instituting a culture of health is an inevitability for a company that is really interested, or for an organization, or for a home space that is really interested in their work, in their health, and in their well-being. And so what do we do when we want to institute a culture of health in the workplace? In simple terms, we do a psychosocial analysis. We do health risk hazards, amongst other things, where we assess the practices that are in an environment. It can be in the workplace, it can be at home, and it can be in an environment where an office or a business is situated. And then we can help and come in and teach you and institute the important rudiments of instituting a culture of health for you, for your employees, and for the environment in which you work. So if you want to learn more on this, or if you want us to help you to institute a culture of health in your environment, in your workplace, in your home, do reach out to us. Bye-bye.